একটা ছোট্ট দাঁতের সমস্যা অনেক সময় আমাদের সারা দিনের হাসি কেড়ে নিতে পারে। অনেক মানুষ ব্যথার চেয়ে ডেন্টিস্টের কাছে যেতে ভয় পান। দাঁতের ব্যথা শুরু হলে কি করেন? পেনকিলার খান, নুন জলে কুলি করেন, নাকি গুগল সার্চ করেন? এছাড়াও আমাদের মনে আরও অনেক প্রশ্ন। রুট কানাল কি পেনফুল? দাঁত তুলে ফেলতে হবে, না এটা বাঁচানো পসিবল? ইমপ্লান্ট কি লাইফ টাইম থাকে? ব্রেসেস ভালো না অ্যালাইনার? এই সমস্ত প্রশ্নের উত্তর পাবেন আজকের এই এপিসোডে। আজ আমরা পেয়েছি একজন অভিজ্ঞ ডেন্টিস্ট এবং লুমিনা ডেন্টাল ক্লিনিকের ফাউন্ডার ডক্টর শ্বেতা গুপ্তা, যিনি 18 বছরেরও বেশি এই প্রফেশনের সাথে যুক্ত আছেন। নমস্কার ম্যাম, ওয়েলকাম টু ডাক্তার বাবু পডকাস্ট।
থ্যাংক ইউ
ম্যাম, আমরা আজকে একটা এমন প্রবলেম নিয়ে আলোচনা করব, খুব সাধারণ প্রবলেম, কিন্তু আমার মনে হয় প্রত্যেকটা মানুষ এটা অনুভব করেছে কোনো না কোনো দিন। সেটা হচ্ছে দাঁতে ব্যথা। এই দাঁতে ব্যথা কেন হয়?
So see, Kuntalji, the number one reason for a tooth pain is a tooth decay. When there is a dental cavity which is getting close to the pulp of the tooth. Now, when we talk about a tooth, it's not a solid structure as we see. A tooth consists of 3 layers. The outer layer is the enamel and the dentine, which is like a hard layer. And inside there is a soft layer known as a pulp, where there is the nerves and the blood vessels of the tooth. Now, when there is a dental cavity which is reaching or involving the pulp, that is when you feel the dental pain. So, a dental cavity is the number one reason for dental pain. But apart from this, another most prevalent reason for dental pain is also an impacted or an infected wisdom tooth. Okay, so these two are the main reasons. Apart from that, dental pain can also be due to attrition, abrasion, because of sensitivity of the teeth. It can also be because of referred pain through your infected sinus.
আর হ্যাঁ, আপনার তো ধরুন এত বছর অভিজ্ঞতা, আপনার কি মনে হয় না যে একটা লোক হয়তো দাঁতের ব্যথা ও হয়তো সহ্য করে নেবে, বাট ডাক্তারের কাছে আসতে ভয় পায়? এর রিজন কি?
I think it is because of the lack of importance that people give to the teeth. People do not consider their teeth as a vital organ. Like body ke kisi bhi part mein, if there is a problem, people are ready to go to the doctor to see whatever, because that fear is there ki kuch serious ho sakta hai. But with a dental problem, I think most people feel that if there is an infection, थोड़ा सा मेडिसिन ले लेंगे, आफ्टर सम टाइम इट विल गेट फाइन, एंड इवन इफ यू लूज अ टूथ, इससे कुछ मेजर होना नहीं है. सो दैट लैक ऑफ अवेयरनेस कि हाउ इम्पॉर्टेंट इट इज़ टू सेव योर ओन टूथ, I think that is the reason why people tend to ignore the dental treatment. And I think also the fear of pain. A lot of people think that dental treatments are very painful, and a lot of people also feel that dental treatments are very expensive. I think that is the reason why a lot of people tend to ignore dental treatment.
আরেকটা জিনিস হয় যেটা হচ্ছে আপনার ধরুন দিনের বেলাতে দাঁতে এতটা প্রবলেম হয় না, মানে ব্যথাটা বোঝা যায় না, কিন্তু দেখা যায় যত রাত্রি বাড়ে সেক্ষেত্রে দাঁতের ব্যথাটা তত बढ़ते থাকে।
राइट,
এটা কি রিজনে হয়?
सो जैसे हमने आपको जस्ट अभी मेंशन किया दैट द टूथ is not a solid structure. It's like there is a pulp inside the tooth. There's a hollow chamber जिसमें nerves and blood vessels होते हैं. So mostly the dental pain is because of an infected tooth, because of a dental cavity which is reaching the pulp. Now when the dental cavity has involved the pulp, there is an infection or an inflammatory response going on inside the pulp, which increases the blood flow inside the pulp. So what happens is, because the tooth is a closed structure, it cannot expand. There's a lot of pressure because of the increased blood flow inside the pulp. अब इससे फिर रात में what happens is, while we are lying down, because of gravity, there is increased blood flow to the head and the neck region. So the blood flow inside the tooth increases furthermore. So now imagine there was already increased blood flow, increased pressure inside the tooth, and while you're lying down, the pressure increases even more, and the tooth is non-yielding. It cannot expand. So much of pressure inside the tooth at night will cause your dental treatment to increase by many folds. Another reason is a psychological reason. What happens is, during the day we are all very distracted. We are talking, we have our work, we are busy with our phones, with our work. So, lekin at night what happens is, everything is quiet, everything is dark. So the entire focus goes on that aching tooth.
Right.
So then because of that, we feel that the pain is much more. So to overcome this pain, what you can do is maybe prop a couple of pillows under your head so that your head is slightly elevated. You can take some over-the-counter analgesics. But this is just a temporary relief. Next day you have to go and see your dentist for a definite solution.
মানে অ্যাকচুয়ালি আমাদের এটা খুব বাজে হ্যাবিট আছে যে দাঁতে ব্যথা হলো সঙ্গে সঙ্গে একটা পেন কিলার নিয়ে নিলাম, হয়তো পেন কিলার খেয়ে হয়তো আমার 2 দিন ঠিক থাকলো বা ব্যথাটা হয়তো কমে গেল আর ডাক্তারের কাছে গেলাম না। এটা আমাদের একটা টেন্ডেন্সি সবারই আছে।
রাইট।
তো এটা কতটা সায়েন্টিফিক?
It is not at all scientific. So what happens is initially जब आपका पेन हो रहा है, the painkiller works, okay? But after some time what happens, the pulp के अंदर में जो nerves and blood vessels है, they degenerate. Then the pain is no longer a chemical reaction. The pain is more of a physical
Other side
reaction.
effects.
Yeah. So then the painkiller also stops working eventually. And then what happens is when the tooth goes into a chronic mode, when there is no pain, but what happens is inside the tooth, the infection inside the tooth starts getting into the bone. That is when you start having an abscess. If you ignore an abscess, it turns into a cyst. So then there's a lot of bone loss. The infection, which is silent, but it is increasing inside. So eventually, though, you will have to do something, right? For some time, maybe you can ignore this because you're not feeling the pain. But after some time, there will be pus coming out of there. The tooth will start getting mobile. You'll start having severe pain. So that time, the only option will be to go for a tooth extraction.
Okay.
And if an RCT can be done at that stage, with the RCT, the prognosis of the RCT also comes down. Then it will require multiple visits. RCT cannot be done in few visits. Then it will require a lot of visits. And suppose if you have to get your tooth extracted, there'll already be a lot of bone loss out there. So when we are placing an implant also, the quality of the bone, the volume of the bone will be compromised. So you should not ignore any kind of a dental pain.
ম্যাম, আপনি যখন 18 বছর আগে আপনার যখন কেরিয়ার শুরু হয়েছিল আর আজ মানুষের মধ্যে কতটা দাঁত নিয়ে সচেতন আছে আপনি লক্ষ্য করেছেন?
See, when I started off, the focus was mostly on pain management. For some reason, the patient is having pain. So the only treatment was focused towards taking care of that pain. You do an RCT, done. Is the wisdom tooth extracted, done. But then that overall awareness was not there. You have to take care of the rest of the teeth also, or what precautions can you take so that the other teeth are not the other teeth remain healthy. So now people are getting a little bit more aware. They feel that they should go for regular dental checkup, but still that awareness is not so much in India, I would say. Like abroad, people go for the regular dental checkup every year, but in India, people still come to see a dentist only when they are having a dental pain.
এটা কি আপনার মনে হয় যে যেহেতু মেডিক্লেম কভার করে না বলে এটার অ্যাওয়ারনেস বা ইচ্ছাটা কম থাকে?
That could be a reason. I'm not sure about that. But more than the mediclaim, I think जैसे हमने आगे भी mention किया है कि people do not take their teeth very seriously. They don't know the importance of the teeth yet. सबको लगता है कि दांत में पेन हो रहा है तो just get it extracted. They don't even want to go for an RCT. There are very few people who understand the importance of a root canal, or how important it is to save your natural tooth, or how important it is to save your enamel and dentine. That awareness is still not there. So I think we should have more programs which makes the people aware that it is very important to save your natural tooth. And they should not undergo procedures in which a lot of their enamel and dentine or the tooth structure is being cut off. So people do not still understand the importance of that. I think that is the reason why they are not so serious towards dental treatment.
क्योंकि बंगाली में कहावत है जे दांत থাকতে দাঁতের মর্ম বোঝা যায়। बंगाली में कहावत है।
True. जब तक दांत है, you will not understand the importance of it. But trust me, like once you lose your teeth now, then you will realize that any replacement, implants, bridges, dentures, nothing is as good as your natural teeth.
Right.
So saving your natural tooth is worth every effort. It's worth every penny. I think if you are given an option to save your tooth, you should try, give in every possible ways to save that tooth, because nothing can replace it.
আচ্ছা, এই যে দাঁতের ব্যথা নিয়ে আমরা এতক্ষণ কথা বলছিলাম, একটা কথা বারবার যেটা উঠে আসছিল সেটা হচ্ছে রুট ক্যানাল। এটা অ্যাকচুয়ালি কি?
So root canal is indicated when there is a dental cavity which is involving the pulp of the tooth. When your pulp of the tooth is involved, when there is an infection inside the pulp, that is when a normal filling is not going to help you. Now you have to go towards a root canal. So in the root canal, what we do is the pulp which I have just mentioned, that is the soft tissue inside the tooth. So in a root canal, what we do is we take out the nerves and the blood vessels which are inside the pulp. We thoroughly clean the pulp chamber and the root canals. Inside the root also there are certain canals. So we clean that canals, we shape those canals, and then we fill it up with an inert material. So root canal is a procedure which is going to save your tooth. So if your dentist has given you an option that you have to go for a root canal, then it's a good news, because that means you can save your tooth.
রুট ক্যানাল শুনলে মানুষে খুব ভয় পায়, এটা কারণ কি?
I think ये जो opinion है ना, it is quite outdated, I would say, because see, modern dentistry does not believe in a painful treatment, and the treatment that we give now to our patient, our primary focus is always on pain management. Okay, we do not believe in treating a patient while the patient is having immense pain. Pain management is our primary requirement. ठीक है, तो ये जो concept है that root canals are painful, it comes from a very old opinion. So suppose you come to me saying that root canals are painful, maybe you have heard it from your father or maybe somebody elderly who has had root canal maybe done 15-20 years back. So abhi modern days, maybe, as I told you, root canal is done under anesthesia. Even before, but now, with in most of the cases we achieve 100% anesthesia, and root canals are very comfortable to the patient. And after that also, when the patient goes home, we put them on proper medication so that they do not feel the pain during that time also. But there are certain times when that 100% anesthesia cannot be achieved. Okay, that can be because of a lot of infection which is there. It can be because sometimes of anatomical reasons, there is a certain way the nerve goes. But sometimes in some people the nerve can follow a different path slightly. It can be in the front or it can be at the back. So that 100% anesthesia is sometimes not achieved. So the patient can feel a little bit of pain during the procedure. And if they are feeling so, then they need to tell us and we can manage that pain also. Okay, so root canals are not painful, to be if I have to say so.
আর ধরুন রুট ক্যানাল, এটা প্রসিডিওর কি একদিনের হয় না, এটা টাইম টেকিং প্রসেস থাকে?
It depends from case to case. In most of the cases, when there is not a chronic infection, I would say, when it is not a long-standing infection, when the infection has just gotten into the pulp, or we are doing a root canal because of a trauma, then it can be done in a single sitting. But if it is a long-standing chronic infection in which the pulp is totally necrosed, there is infection extending onto the bone, there is an abscess, there is a cyst, then it has to be done in multiple sessions.
আর রুট ক্যানাল করার পর কি ক্রাউনের রিকোয়ারমেন্ট থাকে?
In most cases, to be honest, yes. In most cases, we do require a crown or some kind of a bonded restoration like an onlay. Anterior teeth do not always require a crown, so it depends on the extent of damage that is there. How damaged your teeth are, it depends on that. But the posterior teeth, जो पीछे के दांत रहते हैं, उसमें mostly we prefer to give a crown or a bonded restoration.
ক্রাউন নেওয়ার উদ্দেশ্য কারণ benefit কি পাওয়া যায়?
So what happens is, suppose your tooth is going for a root canal or it is indicated for a root canal, that means your tooth is already destroyed. A part of your tooth has already been decayed and some part of your tooth has been destroyed. It has to be cleaned. And that Along with, like when we are doing a root canal, to gain access to the canals, we have to make a certain cavity on the tooth, which is known as an access cavity. So these two combined compromises the tooth structure a bit. The tooth structure tends to weaken a bit. And then what happens is, during the root canal, we are removing the nerves, the proprioceptive, the sensory mechanism of the tooth. So the tooth cannot gauge the pressure with which it should bite on particular food. So these two factors combined, that lack of proprioception and already compromised tooth, can sometimes lead to fracture of the teeth. Okay, so for that reason, to protect the tooth, we give a dental crown, commonly known as a cap.
ডেন্টাল যে ফ্র্যাকচার বলছেন, যেমন আমাদের হাতে বা পায়ে ফ্র্যাকচার হলে আমরা ব্যান্ডেজ করা হয়, তো দাঁতে কি করা হয়?
That fracture. So again, it depends on how the fracture is. Okay, so there are various divisions of fracture. So if it's a Ellis class 1 fracture, जिसमें only the enamel is chipped off, then we can do a filling. If it is involving the nerves, the fracture is involving the nerves. If it is a horizontal fracture, then we can do a root canal followed by some kind of a bonded restoration. But if it is a vertical root fracture, if the root has fractured, then the only option is extraction.
আমার ভিজুয়াল এটাই আছে যে দাঁতে ব্যান্ডেজ করলে কিরকম লাগবে।
No, that bandage हम लोग करते हैं, which is known as splinting. We do it when sometimes because of periodontal reasons the teeth are slightly mobile, or after some kind of an accident there's a little bit of impact on the tooth, because of which it has become a little mobile. So to gain that stability, we splint the teeth from the back. Yeah.
আর এটা কতদিন লংজিভিটি হয় একটা রুট ক্যানাল?
If root canals are done properly, following the proper protocol, mostly the sterilization protocol, and following all the irrigation protocol, if it has been done properly, then a root canal will last a lifetime.
যদি কোনো সময় রুট ক্যানাল নষ্ট হয়ে যায়, সেক্ষেত্রে কি আবার কি নতুন করে করা যায়?
Yes. So yeah, if it is a reinfection, we can do a re-RCT. We prefer to do a re-RCT, but we have to rule out the root fracture. So if your root has fractured, if the infection is because of a vertical root fracture, then we have to go for an extraction. But if there is no fracture, so to rule out whether the fracture is there or not, because this kind of fractures cannot be seen in our regular x-rays, जो हम लोग clinic में x-ray कराते हैं, उसमें this fractures cannot be seen. So we get a CBCT. Okay, CBCT में we get all the views, all the cuts of the teeth, and then we get to know whether there is a fracture or not. If there is a fracture, we have to get the tooth extracted. But if there is no root fractures, then we can do a re-RCT.
আচ্ছা, আরসিটি যে খরচ, সেটা দেখা যায় এক এক জায়গায় এক এক রকমের। এটা কিসের উপর ডিপেন্ড করে খরচাটা?
So the cost of the RCT depends mostly on the expertise of the doctor, the area that you're working, and it depends on the materials that you're using. So the materials that are used in RCT, like a single material can range from 5,000 or it can cost as low as 500 also. The files that we are using, some people use slightly lesser files which are on the lower range. There are files which are much more expensive. So what files you are using? So we don't use files for more than 2 patients. Like, ideally you're supposed to use 1 packet for 1 patient. So depending on all these things, some people, if you're using 1 file for 1 patient, then all these factors, they increase the rate of the RCT. But if you're reusing the files, then the cost will come down. So it depends from practice to practice. The rate of the RCT depends on.
এই ক্ষেত্রে লংজিভিটিও বাড়ে,
of course.
আপনার থাকবে
Longevity বাড়ে, and what happens is one of the major complications which can happen is while we are doing an RCT, the files can fracture in the canal.
Okay.
So if the files fracture in the canal, then the prognosis of the RCT comes down. Okay, the files tend to fracture if you reuse the files many times. So the company guideline is that a single file has to be used in a single patient, and a single pack of file can cost as much as 2,000, 3,000. Now if you're using a file only for 3,000, and there are so many other materials out there, right? So how can an RCT be done for 4,000? It is not possible. So it depends on from practice to practice. What protocols are you following? What standards are you maintaining? It depends on that.
আচ্ছা, এতক্ষণ আমরা যেটা ডিসকাস করলাম সেটা যে দাঁত কিভাবে বাঁচানো যায়। এবার দেখা যায় তো সব ক্ষেত্রে দাঁত বাঁচানো পসিবল হয় না। তো অনেক মানুষ অনেক বছর ধরে হয়তো দাঁত এক্সট্রাক্ট করা হয়েছে বাট ওটা ইমপ্লান্ট করেনি, সেক্ষেত্রে কি ধরনের প্রবলেম আসতে পারে?
So what happens is, ideally, the moment the tooth is extracted, you need to get it replaced with a dental implant or a denture temporarily. We do not prefer bridge so much, but the thing is, the missing tooth has to be replaced. Now I'll tell you why. There is a balance system in our mouth, okay? The upper teeth are contacting the lower teeth. The adjacent teeth are in touch with each other. So when one tooth goes missing, suppose this tooth goes missing, okay, suppose one tooth is missing, then what happens is ये जो उसके ऊपर में दूसरा opposing tooth है, that will start to grow in that area, okay? The adjacent teeth, जो side के teeth है, that will start tilting in that space. So what happens is, like, the upper teeth and the lower teeth, there is a plane, okay? It's in a plane.
Right.
So now what happens when this tooth grows a little bit down, which is known as supraeruption, the way our teeth moves like this while chewing, that gets hampered, okay? So there is one tooth which is down, so it keeps knocking. All right, so because of that, what happens is we start developing habits such as grinding of teeth, and then we start having pain in our temporomandibular joint, temple areas, muscles of the head and the neck region, even cervical pain. It is all related to dental issues,
Sure.
to one missing tooth. Okay, so that is one issue which can happen. And another problem which can happen is when a tooth moves, okay? When it moves, then the contact between the two teeth gets disturbed. The contact loosens up. Now the food starts getting stuck there. When the food starts getting stuck in between your teeth, you are more prone to dental cavities. So not replacing a missing tooth is just the beginning of a very vicious cycle.
দাঁত তোলার কতদিন পরে ইমপ্লান্ট করাটা আইডিয়াল টাইপ?
See, ideal is to get an immediate implant.
Okay.
So what we do is, the moment we extract the teeth, we place an implant that very time in that socket.
আচ্ছা।
Okay. And then after 3 months or 4 months, we give a crown on top of that implant. So this is the ideal situation. But in some situations, this is not possible. If there is a lot of infection because of which your tooth is being extracted, if there is a lot of granulation tissue, like, healing tissue, if there's a lot of if there is a cyst or an abscess or a granuloma which cannot be cleaned properly, then we cannot give an immediate implant. We have to wait for that infection to ward off. Then we wait for another 3 months for the bone to form.
Okay.
3 to 4 months we wait, and then we give an implant.
এটা কি পেইনফুল হয়?
No, implants are not painful, trust me. Like, there is a saying that implants are even like, it's not even as painful as getting your tooth extracted. It's a very simple procedure, and it is done under local anesthesia.
Yeah.
Dental treatments, like I told you, modern dentistry is not painful, but the anxiety, the fear of dental treatment, the seeing the noise, the sound of the instruments, the look of the instruments, that is what provokes the pain, anxiety. The treatment per se is not painful.
ইনজেকশনটা নিয়ে যাওয়ার সেই সময়তেই একটা অন্যরকম।
But trust me, that injection is also not painful, because we numb the area with a spray or a gel anesthetic agent, and then we give the injection, and the injection is also very, very fine. So it is the fear, actually, it's the anxiety, it is not the treatment pain per se.
আর এটার লংজিভিটি কিরকম থাকে?
Of dental implants.
ডেন্টাল ইমপ্লান্ট
Dental implants have a very high success rate of 97 to 98%. Okay, so if dental implants are done in a healthy person, okay, who does not have any systemic disorders, if the implant is placed following proper surgical protocols, if the case selection is proper, if the bone in which the implant is placed is of adequate volume and adequate quality, if the bite forces acting on the implant is balanced, if the forces on the implant is not the implant is not overloaded, then I can say confidently that implant is going to last a lifetime. But then there are certain factors which will compromise the longevity of implants. Now, suppose there is an uncontrolled diabetes, a chain smoker, patients who grind their teeth or clench their teeth, okay, in which a lot of forces are going onto the implant. Now, suppose you have delayed your dental placing the dental implant, and the quality and the amount of the bone is compromised, because of which we are not able to give the implant the length or the width of the implant which we had planned or which would have been ideal. So in these compromised cases, the success rate can go down a little bit, but still I would say the success rate is also very high in even these compromised cases.
ধরুন কোনো কারণে ইমপ্লান্ট সফল হলো না, সেক্ষেত্রে কি আবার নতুন করে ইমপ্লান্ট করা পসিবল?
Yes, of course. Like I said, implant has a success rate of 98%, but 2% change, 2% the failure hote hai.
98% huge.
Yeah, but 2% failure is there. Okay, if you're doing 100 cases, we're following all the protocols, proper sterilization, proper treatment planning, and proper patient planning. Everything is we are following, but still, we do not know why that implant has failed. 2% cases are there. So after that, what we do is we remove the implant, we let the area heal properly again, and then we leave it for another 3 to 4 months, and then after that we replace the implant.
মানে 3-4 মাস পরে নরমাল খাওয়া,
yes,
কাজ ফাজ এগুলো সবই করতে পারবে।
After loading the implant. So implant procedure mein what happens is we place the implant. There's something known as immediate loading. Like if we are getting a proper stability of the implant, then we can give the crown on the same time. But most of the time what we do is we let the implant integrate in the bone, osseointegrate we call it. Like the implant integrates in the bone, it becomes a part of the bone, like it becomes your artificial root. Okay, and then after that, this takes around 3 to 4 months. After that we put some attachments and then we attach the crown. So after that it is as good as your natural tooth. You can eat with it.
মানে সেক্ষেত্রে মাটন চিকেন সব খাওয়া যাবে। আচ্ছা, এর যে কেয়ার, সেটা কি নর্মাল দাঁত যেরকম আমরা রেগুলার কেয়ার করি, মানে সকালে ব্রাশ করলাম, রাত্রে ব্রাশ, সেম কেয়ারই?
Same care, proper care. Any dental treatment will fail if your oral hygiene is bad. Okay, if you do not maintain your oral hygiene, any type of dental treatment is going to fail. So implant me, whatever you do to your natural teeth, for brushing, flossing, the same thing has to be followed. Proper brushing, flossing at night, and regular dental checkups to make sure if there is a problem, it is caught in time. Same thing.
দাঁতের আরেকটা পার্ট, একটা তো খাওয়া, চুইং, এটা তো একটা পার্ট, আরেকটা সব থেকে বড় পার্ট যেটা আমার মনে হয় কনফিডেন্স, মানে হাসি। মানে আমরা হাসি থেকে অনেক কনফিডেন্স বিল্ড আপ হয়, তো সেখান থেকে স্মাইল ডিজাইন পার্টটা এসছে। তো এই স্মাইল ডিজাইন আসলে কি?
See, smile designing is an umbrella term. It's a huge term. It comprises a lot of procedures. It is not a single procedure. Just say I'm telling you RCT, it's a single procedure. Placing an implant is a single procedure. Orthodontic treatment, aligners, braces is a single treatment. But smile designing has a lot of treatment under it. To design a smile designing means to beautify your smile. It is a cosmetic procedure to make your smile better, to improve the looks of your teeth and the gums. Okay, so this can include procedures such as braces, either with metallic braces or with aligners. It can include dental implants. If your teeth are missing, then you have to give implants. It includes teeth whitening. It can include dental veneers or crowns. So it is a umbrella
holistic
term. Yeah, it is an umbrella term for a lot of procedures which will enhance or beautify your smile.
আর অনেকেরই ধারণা যে স্মাইল ডিজাইন মানে এটা হচ্ছে মডেল বা যারা স্টার তাদের। তো আপনার ক্ষেত্রে কি এমনি সাধারণ লোক আসে স্মাইল ডিজাইন করার জন্য?
So there is a difference on there. So what models and celebrities and all are getting mostly these days in social media that we can see, they're getting mostly veneers to make the teeth more whiter, to make the teeth more shapely, to close, to correct minor irregularities, I would say. Okay, but like people like us, like we do not go for that extent, because we do not need to face the camera so much, and we do not that's not our profession. Like looking good is it is like everybody wants to look good, but our career does not depend on it, right? So for actors and all, that is their thing, like, looking good is the primary concern, right? But for us, like normal people will come for things like if their front teeth is missing, they can go for an implant. If the teeth are very irregular, they can go for aligners or braces. If there is a little bit of a yellowing of the teeth, then you can go for bleaching. If there is, most commonly, if there are gaps in between your teeth, then they can go for the closure of the gap either by veneers or by a composite filling. So I think mostly it is confined to this.
আচ্ছা, আমার কি স্মাইল ডিজাইন করা উচিত?
No, I think you have a beautiful smile. I don't think anything is required. Just have to oral hygiene maintain kijiye. I mean, I have not seen your teeth, but that is my advice to all my patients. Get regular checkups, make sure there are no cavities, make sure your missing teeth are replaced. But baki, when I see, it's good.
আচ্ছা, আরেকটা পার্ট যেটা দাঁতের ইয়েলো কেন হয় দাঁত?
One reason is when you're drinking a lot of tea, coffee, or external agents or stains which accumulates on your teeth. That is one factor why the teeth becomes yellow. Another reason for the teeth to become yellow is when you're maybe brushing too hard, when your toothpaste is very abrasive, the particle size of the toothpaste is too much that your enamel is getting abraded. Then what happens is after enamel, the second layer is the dentine. The dentine naturally it's a little yellowish than the enamel. Now when the enamel gets abraded, the underlying dentine starts showing through, which is more yellowish. Okay, so that is when you feel your teeth have become yellow. Another reason is, I don't know whether I should say it or not, but kya hota hai na, sometimes when people undergo treatment with braces, and when it is time for them to get their braces removed, so we have to remove the cement that was bonding the brackets there. So sometimes when we don't take care to use some kind of a special burrs to remove that cement, a part of the enamel also gets removed. So that also I have seen in a lot of cases the patients have come up with yellow teeth. It's basically when the enamel gets abraded and the underlying teeth shows, dentine starts showing, and also because of tea, coffee, red wine, all this dietary habits, tobacco staining.
আপনার এই যে ধরুন ইয়েলো টিথ, এটা কি আনহেলদি টিথের লক্ষণ?
No. See, some people have naturally yellow teeth. Okay? So yellow teeth does not mean your teeth are unhealthy. If it is abraded and eroded, then obviously that's a different issue. But if your teeth are yellowish, some races, they naturally have yellowish teeth. It is also quite relative. It depends on the color of your skin also. So the contrast it has with your skin and the gums also makes your teeth look more yellowish or whitish. But anyways, if your teeth are yellow, does not mean that your teeth are unhealthy. Okay, unhealthy is when you have deposits in your teeth. Unhealthy is when you have cavities in your teeth, which is trapping food. So that is unhealthy. If you're keeping your teeth clean, then color does not determine the health of your oral.
স্মোকিং থেকে তো আমাদের দাঁতের কালার চেঞ্জ হয়ে যায়, ইয়েলো স্টোন আসে। এছাড়াও ওরাল হেলথে আমাদের কি ধরনের ক্ষতি করে
Smoking has a direct correlation to lung cancer, oral cancers. There's no debate about it. So smoking causes dry mouth, and then it it is directly linked to cancer. So smoking is not good, but still we cannot tell our patients ki you don't smoke. We can only put it up in a nice way that smoking is not a very good habit to have.
Right.
But aaj ke time mein we cannot tell our patients that stop smoking. We cannot tell that.
এই টিথ হোয়াইটনিং করলে কি দাঁতের গোড়া আলগা হয়ে যায়? दांतें जो गम वो लूज हो जाता है
व्हाइटनिंग से? नहीं, व्हाइटनिंग डज नॉट हैव एनी रिलेशन टू योर गम्स. इससे गम्स बिल्कुल लूज नहीं होते.
और व्हाइटनिंग कितना दिन तक रहता है?
Again, it depends on your habits. Okay, so on an average, if you're not a chronic, if you're not drinking too much of tea, coffee, stained food, red wine, turmeric, spicy food, then after getting after getting whitening done in a dental clinic, it'll last for I would say 10 months, 8 to 10 months. Okay, but if you're then again drinking a lot of tea, coffee, then it will get stained. Maybe it will last for 5 months, 6 months, like that.
আচ্ছা, এখন আমরা টিভিতে বা সোশ্যাল মিডিয়াতে অনেক অ্যাড দেখি যেগুলো টুথপেস্টটা দিয়ে দাঁত ব্রাশ করলে দাঁত অটোমেটিক্যালি হোয়াইট হয়ে যায়, যেটা কতটা?
It is a very, very dangerous thing, because what happens is with all these whitening toothpastes and also toothpaste जिसमें salt होता है, charcoal होते हैं. So what it does, it is the particle size of this toothpaste is a lot than what is recommended in a FDA approved toothpaste. Okay, so the particle size are very large. So what happens is it acts as a sandpaper. So when we are brushing your teeth, the top layer of your tooth is getting abraded. So the top layer which is stained is getting removed. So you might feel your teeth is getting whiter initially, but on a long run, you will feel that it's getting yellow because your enamel is getting worn off, and then the dentine starts showing through. And the sensitivity issue is obviously more with these toothpastes.
আচ্ছা, আমরা সোশ্যাল মিডিয়াতে অনেক রকম হোম রেমেডি দেখি, যেমন চারকোল বা ধরুন सॉल्ट, नीम का दातून, इससे हम लोग का टीथ वाइट हो जाता है. ये कितना साइंटिफिक है?
See, it is not at all scientific. Like I just mentioned with the whitening toothpaste, salt and charcoal, the abrasiveness of these particles is quite high. So they should not be used. They are just going to abrade your enamel, and enamel is going to get thin and you're going to land up with sensitivity and more yellow teeth. Neem ka datun was used. It's not a very bad thing, but you should not poke it in between your teeth.
Okay.
And you should not use it as a toothpick, because toothpick is again very deleterious to your oral health.
Yes, sir.
So that is, I mean, just use your toothpaste and toothbrush, I would say.
আচ্ছা, আমাদের খাওয়ার পরে অনেক সময় পার্টিকেল যখন ভেতরে চলে, বিশেষ করে যখন চিকেন মাটন আমরা খাই, তো তখন আমরা টুথপিক ইউজ করি. এটা কতটা ডেঞ্জারাস হতে পারে?
Toothpick should not be used. What happens is toothpick now, it forces the food more, it impacts the food particle that is there. Okay, and it does not remove the stuck food as such. So the better way to do is to use a dental floss.
Okay.
We should never use a toothpick. Okay, it will just increase this gap that is in between your teeth. It impacts the food and it will increase the gap. So the better way to use is a dental floss. If your gap is much wider, then the dental floss will not work. Then you have to use something known as an interdental brush. Or you can also use a water floss, which is quite popular these days.
আচ্ছা, অ্যালাইনারটা কি?
So dental aligners are a treatment option for malaligned teeth. Okay, if your teeth are irregular, then how we get braces. So dental aligners is a more discreet alternative to a dental braces.
এটা কি সবসময় পরে থাকতে হয়, না শোয়ার সময় খুলে রাখলাম আবার দিনের বেলায় পরে রাখলাম, এরকম কিছু থাকে?
So the only factor for the most important factor for a dental aligner to consider is that it has to be worn for 22 hours in a day.
Okay.
20 to 22 hours. I would not say 20 also. 22 hours in a day
minimum.
You have to wear your aligners. That means you just have 2 hours or 3 hours to eat, to do your oral hygiene. Rest, every time you have to wear it. Otherwise, your treatment will get prolonged. Like when we're giving aligners, we first scan the teeth. After that, hum log ko pata chal jata hai ki how long your treatment is going to last. It is all very precise. It's nicely calculated. In 6 months your treatment is going to get over, and you will need suppose it's a treatment of 6 months, then you will need 12 or 15 aligners. So but if you're not wearing it for 22 hours in a day, then that calculation goes haywire. We had planned that your treatment to get over in 6 months. Now it might take 8 months, it might take 10 months, it might require a rescan, a new set of aligners. So for the aligners to work, you have to wear it for 20 to 22 hours in a day.
আর ধরুন কোন মিডিল এজে, মানে 40-50 বছর বয়সেও কি এই ট্রিটমেন্ট পসিবল?
Yes, sir. Of course. Aligners can be given for somebody even as old as 60-65 years of age.
যে কোনো এজেই এটা পসিবল?
इसमें there is no age limit to it.
প্রথম বাচ্চাদের কোন সময়ে একজন ডেন্টাল ডক্টরের কাছে নিয়ে যাওয়া উচিত?
So we say that, the moment your first teeth erupts, which is at the age of 6 months, that is when you should go and see the dentist. Okay, and after that you can see the dentist every 6 months or so, or you need to be vigilant about your child's teeth. Like, jab new teeth aa rahe hai, you have to make sure that they are fine, they are not catching any cavities. You have to make sure that you're cleaning your child's teeth at night when they are very small. So you can wrap a gauze around your finger, slightly wet it with water and wipe your child's teeth till the time they can start brushing. And you have to make sure that your child is not sleeping with milk in their mouth, because there's a very common condition which is known as a nursing bottle caries. So kya hota hai, when kids are 6 months to 1.5 years, they have the habit of drinking the milk and falling asleep. So उन लोग के mouth में जो milk रह जाता है, that causes decay of all the teeth. So it is very you can tell the features of is quite distinct of a nursing bottle caries. When you look at a child, all the teeth will have cavities. Okay, so to prevent all these things, you should visit a dentist regularly. And also there is a common perception that milk teeth to future may replace ho hi jayenge, so they are not that important. Okay, so that's a very false concept to have, because what happens is the milk teeth paves the way for your future teeth.
Yes.
Okay, जहाँ milk teeth है उसी जगह में your permanent teeth comes. So it's very important to save those teeth till the time your permanent teeth comes. Sub teeth के there is something known as a chronology of the teeth of dentition. Even there is a time for that. Like first में your permanent teeth comes, the first molar at the age of 6 years, 6 to 7 years. And then 7 years your lower anterior gets replaced. वैसे करके जैसे premolars, milk premolars है, they get replaced at the age of 10 to 12 or 13 years. So it is very important कि जब तक वो teeth का time नहीं हुआ है to be replaced, you have to save those teeth. Because otherwise what happens is, if you remove those teeth before the permanent teeth is going to come in that area, as I told you before, the teeth are going to tilt in that area, so it's going to block that space for the permanent teeth to come. तो फिर क्या होगा, permanent teeth को निकलने के लिए space नहीं होगा, then it comes from side. Okay, so that will, so because of that you will require braces later on.
আপনার মিল্ক টিথ খুবই ইম্পর্টেন্ট, মানে ওইটার উপর ডিপেন্ড করে আমাদের পরবর্তী দাঁতগুলো বের হয়,
রাইট?
মানে আচ্ছা, এই যে চকলেট, কোল্ড বাচ্চাদের একটা হ্যাবিট আছে, মানে বাচ্চাদের আমরা দেখলি প্রথমে চকলেট দিই, এটা তো দাঁতের জন্য খুবই ক্ষতিকারক।
Of course. See, chocolates,
chocolate, chips, cold drink.
Right. So all these things, but also I would say breads, chips, कोई भी carbohydrate containing food gets broken down into simple sugar. Okay. So जो हम लोग के माउथ में bacteria रहते हैं, that will act on this and release acid. Okay. So and this acid will cause demineralization of the teeth, which causes the dental cavities. So if you're having chocolates also, see, you can't keep a chocolate away from a child. बच्चों को तो chocolate चाहिए, we have to give them, right? But what we can do is make sure that after having a chocolate, they rinse their mouth. And the number of exposures are more important. Suppose a child is given a bar of chocolate. अगर वो छोटा pieces करके दिन भर में 4-5 बार वो chocolate खा रहा है, then that is more harmful. Rather you eat the entire block at once. So this is, if you're eating the entire chocolate at once, that is one exposure, one acid exposure of your tooth. But if you're eating it 7 times, 8 times, then that is like 8 times acid exposure. That makes your teeth more prone for dental cavities. So these are the things you can take care of, and use a fluoride toothpaste. Just as I told you, when we eat carbohydrate containing food, the bacteria acts and releases acid. जो एसिड हम लोग के दांत को डीमिनरलाइज कर देता है, जो ऊपर के लेयर है उसका, इससे मिनरल्स रिमूव कर देता है. सो व्हेन वी आर यूजिंग अ फ्लोराइड टूथपेस्ट, जो मिनरल्स रिमूव हुआ है तो फ्लोराइड विल रीमिनरलाइज इट. दैट इज व्हाई इट इज़ वेरी इंपॉर्टेंट टू यूज़ अ फ्लोराइड कंटेनिंग टूथपेस्ट. ओके, सबका लेवल अलग रहता है. लाइक किड्स में वी गिव अ लोअर लेवल ऑफ फ्लोराइड. इन एसिड इन पीपल हु आर मोर प्रोन फॉर डेंटल कैविटीज, फ्लोराइड का लेवल थोड़ा हाई रहता है. सो दीज थिंग्स आर देयर. সো ইয়া.
আচ্ছা ম্যাম, আমাদের দিনে কতবার ব্রাশ করা উচিত?
2 times.
through
2 times. Once at night, which is very important and it's a must. Nighttime brushing is very, very important. More important than your morning brushing. Nights mein after brushing, you have to make sure that you are not eating anything after brushing. And then morning brush, you can brush after you wake up, जो हम लोग का regular practice चला आ रहा है. Or you can also brush after your breakfast, if it suits you.
আর খাওয়ার কতক্ষণ পরে আমাদের ব্রাশ করা উচিত?
So you should not brush immediately after eating, because खाने के बाद क्या होता है, like I told you, the bacteria starts acting on the food and releases acid. तो हम लोग का mouth का environment थोड़ा सा acidic हो जाता है. So in that acidic environment, if you are brushing, you're rubbing your teeth with the acid, you can imagine there will be some amount of wear of the teeth. So you should wait for at least half an hour for your oral environment to neutralize. इसके बाद you can brush.
আর আমাদের ব্রাশ কিভাবে করা উচিত? মানে আমরা তো ব্রাশে নিই আর এরকম করে ব্রাশ করে মানে কোনো একটা প্রপার আমাদের মনে হয় ওই প্র্যাকটিসটাই নেই যে কিভাবে ব্রাশ করা উচিত.
This is very important. So a lot of patients who come to the dental clinic, obviously they are coming because they have a dental problem, and everybody says the same thing ki ma'am, we brush twice a day. Some people even brush 3 times a day. How can I have cavities? Why are there deposits in my teeth? I'm brushing twice a day, I'm brushing every day. फिर भी क्यों deposits है, क्यों cavities हो रहे हैं? So the answer is improper brushing technique. Okay, if you're brushing properly with a fluoride toothpaste, there's no way you'll have any problems in your teeth. But what happens is people don't brush properly. It's not their fault because they are not been taught, right? So I'll tell you, while brushing, what you have to do is so this is your upper arch and the lower teeth. Okay, दांत के this is the outer surface, this is the inner surface. Okay, this is the occlusal surface, and दांत के बीच के surface जिसको interdental surfaces बोलते हैं. So when you are brushing your teeth, make sure you follow a proper sequence so that you brush all your teeth. So you start from the upper right. Okay, इधर से आप start कीजिए. You go all the way down, all the way like this. Then you come down. ये बाहर के side में brush कीजिए. Then you jump inside. अंदर के teeth साफ कीजिए. ऊपर में आइए, अंदर कीजिए, and you finish off where you started. Okay. So and then you clean the top surfaces. So while you're brushing, a lot of people, what they do is brush like this. Okay, so imagine it's like it's like some vertical rods are there. So it's like a comb, suppose. So you can't brush it like that, right? Agar your comb ka bristles are going like this, you have to brush vertically. Okay. Right. So when you are brushing, you take your toothpaste. So this is your teeth, okay? Right. This is your tooth, and these are your gums. So you take your brush for the upper tooth. Suppose you are brushing. You face your brush. You keep your brush facing upwards at the junction of the gum and the tooth. ऐसे करके इसको रखिए. थोड़ा सा इसको अंदर पुश कीजिए so that your bristles are getting engaged in these areas. जो दांत के बीच के areas हैं, जो दांत के बीच के areas हैं, those are getting involved. Okay. So you keep it like this at the junction of the gums and the teeth. ऐसे करके रखिए. थोड़ा सा पुश कीजिए, थोड़ा सा टिल्ट कीजिए, एंड जस्ट वाइब्रेट इट. ओके, ऐसे करके वाइब्रेट करके पुल इट डाउन. दिस पुलिंग डाउन इज वेरी इंपॉर्टेंट. ओके, सो इससे क्या होगा, ये जो बीच में आपका ये जो क्रिवाइसेस है, ये जो गैप्स है, इसमें जितना भी आपका डिपॉजिट है, दैट विल कम डाउन. ओके, देन दिस साइड इज डन. यू डोंट नीड टू कम बैक. देन मूव अगेन टू दिस साइड, डिपेंडिंग ऑन द विड्थ ऑफ
one time.
Yes, depending on the width of your brush, at a time either 3 or 4 teeth will get involved. Now suppose you're cleaning your front tooth, at the junction of the gums and the teeth, ऐसे करके tooth को रखिए, थोड़ा सा inside push कीजिए, tilt कीजिए, just vibrate it. Vibrates not like this, just fixed vibration like this. Okay, count 1 2 3 4 5 6 7 8
इससे इलेक्ट्रिक जो ब्रशेस होता है,
pull it down.
इलेक्ट्रिक ब्रशेस इससे ज़्यादा काम करेगा क्या?
So electric brushes doesn't mean better brushing. Okay, so if you're using an electric brush, you can use an electric brush, but this is also equally good. In fact, I would say even better. But electric brush में क्या होता है, you have to let the brush go at its own pace. You shouldn't force, because see, if you're brushing your teeth like this, ठीक है, fast जा रहा है, then these areas are getting burnished. इधर तो bristles जा ही नहीं रहा है, इधर बीच में it's moving like this, right? We need that the bristles should go inside this area. So if you're using an electric brush, use it like this. Let it rotate and go up like that. Okay.
अच्छा माउथ वॉश क्या रेगुलर करना ठीक है?
No, not at all. So regular use में we do not advise mouthwash. Okay, so mouthwash contains alcohol, and even if it does not, it's an alcohol-free mouthwash. We do not recommend mouthwash on a regular basis. It is not required. Your proper brushing, flossing is more than enough for your everyday oral hygiene. So what a mouthwash does is, see, in our mouth there are a lot of good bacteria. There are some bad bacteria as well. So when you are using mouthwash regularly, the population of the good bacteria goes down. Okay, so then when the good bacteria ka population goes down, then the bad bacteria starts, and bacteria, other microorganisms, they start proliferating in your mouth. Okay, so and then because of that, then you'll end up with certain problems such as candidiasis. You can have bad breath. You can end up with dry mouth. So it is not recommended at all to use a mouthwash.
এতক্ষণ আমরা অনেকক্ষণ ট্রিটমেন্ট নিয়ে কথা বললাম, এবার একটু ট্রিটমেন্ট থেকে বেরিয়ে আমরা জানতে চাইবো ডক্টর শ্বেতা গুপ্তা সম্পর্কে। আপনি যদি ডেন্টিস্ট না হতেন তাহলে কি হতেন?
Well, up to it's been a very long time. I would say around 30 years back, or maybe, yeah, I wanted to become a fashion designer. But you know how parents are. They're like, you know, that's not a proper job. You need to have a degree, a proper degree hona chahiye. Then as a hobby, you can do your fashion designing. And then I come from a family of doctors. So my father was like, you know, be a dentist. It's good for girls, no emergencies. So that's how I ended up taking dentistry.
আর আপনার কেরিয়ারে এরকম কোনো চ্যালেঞ্জেস আপনি ফেস করেছেন?
Challenges as in, like, see, yeah, so when in the earlier stages, like even now when patients come, you know, they'll judge a doctor by the way they look. They want that, they feel the doctor is not very experienced, or if it is a lady doctor treating, abhi bhi wo hai, like, you know, if it's a lady doctor, that a little doubt seeps in the patient. So that is one challenge which I see, but it's okay.
আপনার ফেভারিট ফুড?
I like very simple home food always, but if sometimes we go out, then I prefer Chinese or Japanese.
ভেজ না নন ভেজ?
Veg.
টি না কফি?
Tea.
ফেভারিট সুইট?
I have a bad sweet. I have a sweet tooth. All sweets, like I like Indian sweet, chocolates, confectionaries, anything sweet I like.
আপনি তো একটু আগে বলেন চকলেট হার্মফুল।
I know. I have a lot of cavities, and I myself have a lot of root canals done. When I was younger, not a dentist that time. But yeah, I have a sweet tooth.
आपका फेवरेट हॉलिडे डेस्टिनेशन?
My favorite holiday destination would be Europe.
উইকেন্ডে আপনি কিভাবে টাইম কাটান? ফ্রি টাইম?
Weekends I spend with my kids, I spend with my family. Yeah.
আজকের এই এপিসোড যারা দেখছেন, যে দর্শক ডাক্তারবাবুর যে যারা দর্শক আছেন যারা দেখছেন, তাদের জন্য যদি আপনি একটা হেলথ টিপস দেন দাঁত নিয়ে, তাহলে সেটা কি হবে?
Apart from proper oral hygiene, I would say go for regular dental checkups. Every year, once a year, go for a dental checkup. That will really, like, you know, improve your oral health. That will also change your attitude towards dental treatment. That will reduce the necessity for any future dental treatments.
Okay. থ্যাংক ইউ ম্যাম, আপনি যে এত ব্যস্ততার মধ্যে আমাদের যে সময় দিয়েছেন তার জন্য অসংখ্য ধন্যবাদ। আর এই যে গোটা বিষয়টা আপনি যে এত সুন্দরভাবে সহজভাবে বোঝালেন আমাদেরকে, তো আমরা তার জন্য খুবই কৃতজ্ঞ। থ্যাংক ইউ ম্যাম।
Thank you so much for having me, Kuntaji. It was like my pleasure and a huge honor that you called me for this podcast, and I hope it is useful for a lot of people listening to it. Yeah.
Thank you.
Thank you so much.
আজকের এই আলোচনা থেকে একটা বিষয় পরিষ্কার, দাঁতের প্রবলেম যত তাড়াতাড়ি ধরা পড়ে চিকিৎসা করা ততটাই সহজ হয়। তাই পেন কিলার না খেয়ে যত তাড়াতাড়ি সম্ভব আপনার নিকটবর্তী ডেন্টিস্টের সাথে যোগাযোগ করুন। এই ভিডিওটি যদি আপনাদের উপকারে লাগে অবশ্যই শেয়ার করুন, লাইক করুন, কমেন্ট করুন। আর এই ধরনের হেলথ কেয়ার ইনফরমেশনের জন্য আমাদের ডাক্তারবাবু চ্যানেলটি অবশ্যই সাবস্ক্রাইব করুন। ভালো থাকুন, সুস্থ থাকুন। নমস্কার।